Good morning. My name is Alvin Akupan, and I'm presenting on behalf of UNLV. And I would like to present to you the family health systems theory that I chose for my project. I'm excited to share with you the important concepts of this theory, as you will learn the important concepts of this theory, how the definitions of this theory, and also how I will apply it to my nursing practice, research projects that I entitled it to, and also how it applies to the family that I'll be assessing for the family assignment. So let's get on with this slide. I'd like to include this specific slide, although a common quote, it's birds of a feather flock together. And all of Murray Bowen's concepts are included in this theory or in this picture, as it depicts that all the units in a family influences one another. As you can see here, everyone's relying on the main person in the middle, who is, I guess, the mom. But each and every one of these individuals rely on each other. So what is the family health systems theory? It was created by Murray Bowen, a late psychiatrist that focused on family systems, and he theorized a theory. So what is the family health systems theory? The family systems theory was created by the late psychiatrist Murray Bowen, who developed the theory for human behavior that viewed the family as an emotional unit and used systems thinking to describe complex interaction in the unit, also known as the family. According to Akai Kenyon, Coelho, Still, and Robinson, the family systems theory is an approach to assess and understand families as an organized whole, based upon each other. So, what is the family health system consist of? It consists of many important concepts. Concept number one is all parts of the system are interconnected. As you can see here, this is a great diagram that I like to portray that shows the different shells or layers of an individual, family, extended family, a social level, and multicultural level. One influence on each shell affects another shell, and thus so from the top shell to the bottom shell. As you can see, there's a nuclear family, extended family, social, and multicultural. A great example is whenever one individual doesn't pull throughout the day, or is being hospitalized or becomes sick, another one must make up for it. So formal and informal roles of all these family members are affected. What affects one member affects the other member in the multicultural, social, extended, and nuclear level, which upon so affects the individual. The next important concept is the whole is more than the sum of its parts. For Bowen, this is very extremely important because, as you can see in the middle, the systems is in the middle, as well as the family support, meal practices, and every ritual that's surrounding it. Outside of these systems are rituals, and these are technically parts of the whole. If a ritual is stressed and it's lost its routine, the whole is affected by it. For example, if a family member is used to picking up the mother from work, but the family member, say the daughter, does not arrive or she gets sick, someone must make up for that. Someone in the family. So the family loss is much greater than the individual loss of this so-called ritual or tradition. Another concept that Dr. Bowen portrayed is all systems have some form of boundaries or borders between the system and its environment. Families, depending on their boundaries, have flexible, open, or closed boundaries, meaning the communication goes in and out. As you can see here in the diagram, there's an open and closed system, and depending how much communication they let out, it's up to the family members to decide whether communication of the family member must or must not come out of the family. Some families are open at discussing their family's issues, some are not. Very, very common in the emergency room that I work at, or hospital setting. Lastly, the last concept Bowen introduced is very important also is systems can be further organized into subsystems. Uh, Instead of viewing the family as a whole, nurses can think about the subsystems of the family, which may include husband to wife, mother to child, or even father to child. What this does, it helps the nurse understand that there are dimensions to the family, and family nurses can streamline interventions to achieve specific family outcomes. Very important in assessing and making interventions for the family. So, what is the definition of family in Bowen's family systems theory? He viewed family as an organism. He viewed that properties are greater than the sum of its individual parts, and each part is emotionally dependent on each other. The whole is more than a sum of its parts, according to Bowen's definition of family. According to Bowen, the definition of health, or how it relates to his concepts of his theory, is when an individual experiences a health event, all members are affected because they are all connected. As I explained in the last slides, all parts of the system are interconnected, so health is greatly a main issue when it comes to one's health deteriorating, or if there is a life event or a health event that needs to be addressed.